This week on Healthy Living, we look at uterine fibroids, a reproductive health concern many women experience silently. Medical experts in Uganda step up efforts to encourage more fibroids patients to seek medical care. Also, measles cases rise by 20% worldwide, while Rwanda successfully contains its Marburg outbreak. Plus, in Southern Africa, efforts are underway to make snake bite treatments more accessible and affordable. We'll have these stories and more in this edition of Healthy Living. Hello, I'm Lina Khmoudou. Welcome to another episode of Healthy Living. Uterine fibroids, also called leiomyomas, are common growth in the uterus. They vary in number and size and are non-cancerous. Many women who have uterine fibroids don't have any symptoms. Those who do may experience heavy menstrual bleeding, pain in the stomach or lower back, and constipation. The disease can cause infertility. According to the U.S. National Institute of Health, NIH, fibroids are a global burden impacting 80% of women of childbearing age. However, they are more prevalent among Black women, including in Africa. In Uganda, government data reveal that 4 in 10 women in the East African country suffer from uterine fibroids. Despite the availability of non-invasive options to treat the condition, many women still hesitate to seek treatment.
Uterine fibroids is a condition common in women by the onset of menopause, where benign tumors grow in the uterus, causing symptoms such as abdominal pain, frequent urination, and heavy menstrual bleeding. According to studies, uterine fibroids are said to be a major source of morbidity, especially in Black women of reproductive age, including in Uganda. Dr. Athaire Susan is an obstetrician and gynecologist at the Mulago Specialized Women and Neonatal Hospital in Kampala. She says as the fibroids grow, they can cause excessive bleeding, pain and discomfort, and yet many women delay seeking medical attention.
Some of these women may come in with frequent micturition or frequent passing of urine because the growths are pressing onto the bladder. Some may actually also get constipation because of the pressure on the rectum. Then we see some women coming in with infertility, failure to conceive.
38-year-old Jaliat Namwaya experienced similar symptoms when she was 25 years old. She tried herbal medicine, but that did not ease the condition or bring relief. Namwaya then decided to seek treatment in a hospital.
When I walked to the hospital, actually it is what they saw. They saw the blocked tubes and then some fibroids there. They gave me some medicine for the fibroid specifically.
Jaliat says following doctor's advice, she underwent surgery, followed by hormonal injections for up to 6 months. That stopped the bleeding for some time, but by early 2023, the pain and bleeding came back, throwing her into panic.
What could this be? Why is the pain coming back until March? Why am I not getting pregnant? You know, when you're not getting pregnant, our African society, you are condemned like nothing, starting from your husband, who would like to stay with someone who cannot get pregnant too. Actually, some people say that this woman is cursed.
Dr. Athaire points out that although minimally invasive treatments are available to treat some uterine fibroids, most women fear surgery and avoid coming to a hospital.
Not every fibroid has to be removed surgically. There are some that we can actually observe. If they're not giving you a problem, they can, you can live with them.
Dr. Athaire says alternate treatments are available, including high-frequency ultrasound to dissolve the fibroids and uterine artery embolization to block blood vessels to the uterus. Professor Anne Beatrice Kihara is president of the International Federation of Gynecology and Obstetrics in Africa. She says while women need to get frequently screened, governments need to do more to make hospital care accessible and affordable.
Fibroids, you have to first ask pertinent questions like, Does she want her fertility retained? Or has she finished her reproduction? And if she's having very severe bleeding, what would be the priority management? Would we have to remove the uterus? Would we have to remove the growths? Would we have to use some family planning methods that can even check the amount of bleeding an individual is experiencing? So all this falls back then. What does the insurance cover? And how much of out of pocket does then a woman need to actually provide?
Experts say because of the high financial cost associated with treating uterine fibroids and the societal pressure to give birth, Jaliat and many other Ugandan women continue to suffer from uterine fibroids. Halima Athmani, VOA Africa, Kampala, Uganda.
What do you know about fibroids, and what do you think can be done to better help women who suffer from fibroids in Africa? Here are some reactions from Nigeria.
As a woman, but seriously, I'm not a medical personnel, so I don't really know much about fibroid. But I know it's one of the diseases that can cause a woman not to give birth. There are a lot of women out there that are walking around with fibroid actually, and they don't know that it's fibroid that is doing them.
I've heard so many cases about fibroid from people I know, and fibroid typically isn't really a... People live with fibroid. People actually do live with fibroid. It isn't a big problem because it really doesn't show any symptoms or causes any severe issue to women, but then there are some that do experience a lot of pain. In some countries or in some states, you see some women with like big stomach, or they come to the hospital complaining about pregnancy for about a year plus, thinking it's a whole pregnancy they're going on with, but then they find out that it's fibroid that big.
I think fibroid is a bacteria or disease that stops women from giving birth or womb infection. So I think they should organize free surgery, and also married men should help their wives and support them.
The little I know about fibroid is it's a growth that comes out of a lady's womb, which may sometimes result to as a lady not getting pregnant. No, seriously, I don't think there is, because most ladies don't know what's wrong with them. The moment they just feel somehow, they just feel a little bit of pain, they just feel, they don't like try to go to the hospital to know what exactly is wrong with them. They just leave it and till it expands something very big.
Dr. George Guako is a senior lecturer at the University of Nairobi, Kenya, Galaxy Gynecare, Kenya. He discusses what is fibroid and what can be done to assist both new and old patients.
The etiology or the cause of fibroids is actually not known, but we know that there are certain features or characteristics that predispose women to getting fibroids. For example, women with fewer or no children, so low parity. Women who have their menses early, maybe below 10 years of age. Use of hormonal contraceptives is very controversial. Women with obesity, hypertension, diabetes, but there's also a very strong genetic component. We know that fibroids tend to run in families, and also quite common in African race compared to the Hispanics and whites. And then lastly, lifestyle issues, for example, diet rich in meat, alcohol intake, smoking, and deficiency of vitamin D. We normally classify the presentations as menstrual disorders. There are those ones that can cause pelvic pressure, and they can also interfere with fertility. If I start with the first one, menstrual disorders, the commonest presentation would be heavy, prolonged menstrual bleeding. For pelvic pressure, it would be mainly subserosal huge fibroids. They can compress the bladder based on where they are. They can compress the rectum or the intestines. They can also compress the pelvic veins, whereby somebody can get a deep venous thrombosis or varicose veins. For fertility, yes, we do know that fibroids sometimes can cause infertility. They can cause recurrent pregnancy losses. And during pregnancy, they can cause pain. and they can also interfere with the rotation of baby during pregnancy, maybe necessitating a cesarean delivery, and after delivery, they can also cause postpartum hemorrhage. But having said that, it's also good to know that in about 30% of women, they can have fibroids and still remain symptom-free. Several treatment options, depending on where they are, the size, the clinical presentation, the age of the patient, and their fertility desires. Generally, the treatment options will be classified into three. So there are those ones where we do watchful waiting. I mean, if somebody is young and they have fibroids and they're not causing any symptoms, you watch. You don't have to do anything. So the advice is that they need to go for checkups. And as we said, they are not cancerous, they are treatable. There are several treatment options. It doesn't mean that if you have fibroids, your doctor is going to remove the uterus. Kindly go for regular checkups.
Global measles cases have surged by more than 20% to an estimated 10.3 million last year, according to a joint publication by the World Health Organization and the U.S. Centers for Disease Control and Prevention. Around 107,000 people, mostly young children, died, even though the disease is preventable with the measles vaccine. The researchers report that there has been a global decline in the number of people getting vaccinated since the COVID-19 pandemic. In 2023, only 83% of children worldwide received their first dose of the measles vaccine through routine health services, and only 74% received their second dose last year, the study showed. Meanwhile, Rwanda's health ministry has declared the end of the Marburg virus outbreak with no new cases for nearly 2 weeks. The outbreak was first announced in the country in late September, and Rwanda began vaccinating against Marburg in October. Marburg is a highly infectious hemorrhagic fever with a fatality rate of up to 88%. But the outbreak in Rwanda saw a far lower mortality rate of just under 23%, according to the country's health ministry. Authorities there say they remain vigilant and are carrying out increased surveillance of fruit bats for the virus. Snake bites are classified as a neglected tropical disease by the World Health Organization. In South Africa and other countries in the region, there are numerous barriers to getting the antivenom necessary to save lambs and lives. But scientists are working to make antivenom cheaper, safer, and easier to produce. Kate Bartlett reports from Johannesburg.
It's summer in southern Africa. That means snakebite season. Saka von Veek from the African Snakebite Institute conducts trainings like this one on how to handle venomous snakes, like these cobras.
They get more active, they start moving around, and we do see an increased number of bites as it starts warming up.
One of the things about rural communities, and particularly people who can't afford modern medical care, is that their first port of call is not the doctor's surgery, but the traditional healer. And so those cases never get collected by health statisticians anyway.
But even when people do manage to get from the rural areas to a hospital in time, there are challenges. Antivenom can cost thousands of dollars. Sometimes there are shortages because of low levels of production.
So what we do is we go to those same producers of antivenom into the horses and look for the bits of DNA that can make these super antibodies, these super antivenom products. And then we take those DNA and we clone them in the lab, and we then improve them.
Without the horses, the product is safer and more uniform. It will take many years to go from the lab to the clinic, but Wibmer expects the antivenom would cost only a fraction of the price. Kate Bartlett, VOA News, Johannesburg, South Africa.
Thanks for watching Healthy Living. For the latest news and coverage, stay connected to Voice of America at voanews.com. You can follow me on X at @LenorMoudou. That's our show for today. Until next time, stay well and strive to make every day a healthy day.